Hi, welcome back. In this video, we will learn about what a mother can do if she feels that her breast milk is reduced. A lot of times, a woman may have, or mothers may have doubt that whether their milk is sufficient for the baby, and uh, and they may complain that they don't have enough breast milk and the baby is always crying. They may say, doctor, please give me a prescription for a good formula feed. I don't have enough milk. I have started complementary feed. My baby is always hungry. My mother says my breasts are really small and I will not have enough milk for my baby. I don't have enough milk. My baby feeds very infrequently, sleeps well at night, taking only a feed at night. I have started my baby on cow's milk and I have breast milk, but my auntie says it's inadequate and the baby is small. So not enough milk. This is the most commonly a false perception because of the negative opinion of the person, of the mother herself about herself, or because of the persons around her. And she may have uncertainty about her capacity to feed, and she may not have adequate knowledge about normal feeding pattern. She may think she may be worried about that her breast size is small and may not be able to secrete enough milk for her baby, and she may think of introducing complementary feed early. So you should consider that the perception of a mother is false if the baby is sleeping adequately for 1.4, 1.5 hours, 3 hours after each feed, as the baby is passing adequate urine around 6 to 8 times every day, if the baby is gaining adequate weight, that is at least 20 to 30 grams of weight every day, or the baby crosses the birth weight by 2 to 3 weeks, and if the milk is ejecting from opposite breast while feeding from one side, then that means the mother is having adequate milk. Now, what if it is true? What if the milk is insufficient? How will you know? In that case, the weight of the baby may be stagnant. It will not increase adequately. It will increase by around less than 20 grams a day, or if it may remain stagnant. The urine may become concentrated yellow or decreased in amount, decrease in number of times. The baby may nurse frequently. That means every hourly the baby tries to feed. Baby may nurse continuously. That means the baby will not leave the breast, may continuously suck for hours together. And baby may have constipation or may have hard ferret-like stools. And when the mother tries to express, she may not have adequate milk. In that case, what are the causes of low breast milk? Breast milk may reduce because of breastfeeding related issues, or if because of mother's psychological and social factors, or because of mother's biological factors, or by baby's biological factors. Now let us first learn what are the breastfeeding related issues which can reduce breast milk. So if the breastfeeding is initiated late, then it can reduce breast milk. So you have to initiate the breast milk early. If the breastfeeding is done for short duration, then that can reduce breast milk. So you have to feed the baby for long duration. If the baby is not feeding long, then you have to, if the baby is having nose block, open the nose using saline nasal drops or suck it using your mouth, and burp the baby if the increased gas in the stomach is preventing the baby from feeding for long duration. And infrequent feeding, the mother is not frequently feeding, that can reduce breast milk. So frequently feed the baby as soon as possible, as far as possible, whenever the baby shows signs of hunger. The signs of hunger is the baby turns the head and licks. That means the baby is hungry for feeding. And do not wait for 2 to 3 hours or till the baby cries for feeding. And not giving night feeds, that can also reduce breast milk because it is in the night that the prolactin hormone, which is a hormone responsible for production of milk, is produced in the body of the mother. So feed at least 4 to 5 times at night. Then having a poor attachment, the baby is not attaching properly, just sucking at the breast of the nipple. That also reduces breast milk because it causes a lot of problems like cracked nipple, breast encouragement, mastectomy, breast abscess, and so on. And pain. So pain reduces breast milk. So it is important to have a deep attachment. So for establishing deep attachment, you can use the opposite hand to hold the neck that is a cross cradle position, or you can use the same side hand to hold the neck, that is the football position. Support the baby's body, hold the baby close to your uh, stomach. The stomach should touch the belly, should touch the belly, and support your back with a pillow. And so position and attachment is important for adequate breast milk production. Use a bottle and pacifier, and also giving food and other fluid that can reduce breast milk. Now, how will it happen? See, using bottle and pacifier causes infections in the baby, especially if the sterilization is not correct. And pacifier is not at all recommended for use. So infections like throat infection, ear infection, pneumonia, loose stools, all these will reduce the baby's ability to feed. And therefore, it is important to give exclusive breastfeeding in the first 6 months. Now, what are the mother's psychological and social factors which reduces breast milk? So, her own thinking that she has less milk, that can reduce the milk output. If she has less milk, in reality, then she need to get de-stressed. We need to support the baby's milk demand. Maybe we have to supplement a little formula feed. If the baby is not gaining weight, if the weight is stagnant, if the urine output is reduced, and secondly, if mother is having some illness, so treat the illness. And if the mother is not directly able to feed the baby, express the milk and give the baby through spoon. If the baby is refusing because the baby is having some throat or intestinal infection, then you may have to admit the baby and treat the baby and give the mother's milk through a spoon or tube or a gastric tube. Then working mother. So mothers may not be available. It is better to feed exclusively in the first 6 months. Take as much as your leaves, maternity leaves. And if you are not available for feeding the baby, then express your breast milk and give every 2 to 3 hourly or on demand. Some mothers rarely may have dislike for breastfeeding. They need to be educated. Every mother needs to be educated about the advantages of breastfeeding. See, the baby prevents the breast cancer and ovarian cancer in the mother, and the mother will help in the survival, growth, and development, the psychological development of the baby. So the mother is the medicine for the baby, and the baby is the medicine for the mother. So it's important to continue breastfeeding for your baby. Then fixed schedule feeding. So feeding at fixed time, say every 2 hours, that can produce stress and reduce breast milk. So the mother has to feed as per the baby's hunger cues. As soon as the baby shows signs of hunger, she has to feed. Don't wait for baby to cry, or don't wait for every 2 to 3 hours for feeding. Lack of confidence. You need to give more confidence, improve the self-belief of the mother that she can give adequate breastfeeding. Then stress. Stress can reduce breast milk. So you need to de-stress the mother, give adequate food, give adequate hydration, and she should have adequate sleep. She should sleep with the baby, especially during the daytime, because it is during the night that she has to feed most of the time. Religious customs. Maybe there may be some religious customs which involves giving the baby some for water or honey or sugary syrup before giving breast milk or during breastfeeding. So you should avoid giving anything else because of risk of infections, and infections can cause even death to the baby. Now, what are the biological factors which can reduce breast milk? Biological factors are inverted nipple. Nipples may be inverted, may be flat, may be small, may be very large. The baby may not be able to suck adequately. So in those cases where till the baby is able to suck directly and deeply, mother has to express her milk and give every 2 to 3 hours. Pain. Pain may happen in the breast because of poor attachment, causing sore or cracked nipple and engorged breast, infection like mastitis and breast abscess. So you need to produce a deeper attachment to prevent all these factors, and use adequate position, good position while feeding, and treat all the conditions. If it's an engorged breast, then you have to express the milk every 2 to 3 hourly so that the pain also reduces and the mother will have sufficient milk. Then pain anywhere else, especially in the back pain. So if there is back pain, you may have to do a back massage at least 4 times for at least 10 minutes on the sides of the spine. You should never massage on the center of the spine, but you should only do on the side of the spine. And other causes are chronic mother illness, then hormone problems like thyroid, hypothyroidism, psychiatric illness, mother's drug and alcohol, smoking abuse, and anatomically abnormal breast or rarely a retained placenta. Then there may be problems of the baby because of which mothers may have less milk, like nose block or maybe other illness like pneumonia. Some babies may have cleft lip and cleft palate or neuromuscular disease. Some babies may have brain problem like neonatal encephalopathy. Some babies may not be able to directly feed because the baby is preterm. And hypotonia because of the muscular tone is low, or some babies may reject breastfeeding because of some infections, maybe, or some other problem like infections of throat and intestine. Baby may not be able to feed adequately. In all these cases, if the mother is not able to directly feed, she can express every 2 to 3 hourly and give the baby her breast milk by spoon or cup or tube feeds. Antenatal screening can be done for mothers who may have less milk. Uh, she can look at the nipples, see whether it is retracted, see whether the mother has some systemic illness, whether the baby has some systemic illness, and educate the mother regarding the advantages of breastfeeding, because as I've already said, breastfeeding is so important for both the mother and the baby. And correction of the nipple retraction, which is less helpful, however. Listen to the mother. What to do? You have to listen to the mother and assess the breastfeeding. Examine the baby for any problem. Examine the mother for any problem. See her breast, whether the nipple is retracted. Build confidence and give support and counsel and follow. And therefore, to improve the condition, reduce breast milk, initiate breastfeeding as soon as possible and supervise for a good position and deep attachment and latching. And do a longer breastfeeding duration with the relief of any nose block and burp after each feed, especially if the baby is having gas in the stomach, which may be suggested by presence of hiccups or nausea or distended belly. And frequently feed as often as possible based on the hunger cues, and feed even if the baby becomes awakened because of the urine, the motion, or the baby is on your shoulder and baby becomes awake, still you can feed. Then feed during night time also, at least 4 to 5 times. That will also improve the milk of the mother. Then mother's diet, she should have adequate diet, avoid having food from outside which may upset her stomach, and have adequate food and have adequate sleep, especially during daytime and with the baby. And she can have adequate food. Even some food are thought to increase the breast milk. There may be some medicine that increases the breast milk. She can contact her obstetrician and get the medicine. Rooming in, skin-to-skin contact improves breast milk. She can hold the baby after getting out the gas, keep the baby on her chest, do skin-to-skin contact for at least 1 hour or more than that, at least 5 to 6 times or more times. Then it's important to have a lot of self-belief and confidence that she will be able to breastfeed her baby and address any pain, any problem. Back massage can be done, especially on the sides of the spine, at least 4 times if she has any pain. Now, very often these mothers may have an irritated baby, and the baby's crying may cause a lot of stress and anxiety. However, you have to differentiate whether the crying is a normal cry or an abnormal cry. A normal cry happens because of hunger, thirst, sleep, or discomfort after passing stool or passing urine, after extremes of temperature, maybe low temperature or high temperature, baby is having pain, too many visitors, and mother's food, then Then abnormal cry. Abnormal cry means the baby is crying excessively. The cry is longer, maybe lasting more than 20 minutes, and the cry is not consolable with feeding or holding the baby. That can happen because of extreme pain, because of some illness, because of raised intracranial pressure and in the head, because of some fractures which may happen, because of colic, because of seizures, because of interception, which is an intestinal condition, because of insect bite, because of some rash, painful rash. Maybe baby is having vomiting and intestinal pain, diarrhea, a urinary tract infection, maybe a cow's milk protein allergy, or a perineal excoriation. So it's important to examine the baby, look at the temperature, heart rate, respiratory rate, look at the head, the ears for ear infection, foreign body may be there. There may be bites, rash, injury, joint swelling, pain on handling. Then there may be the abdominal distension. There may be hernia, which is the intestines protruding through holes in the umbilicus or in the inguinal area. The scrotum should be seen. There may be hernia in the scrotum, or there may be poor increase in weight, failure to thrive, then fracture. So this is a baby with a large head. The pressure may be high, and that baby may have excessive cry. This baby has some rash on the head and may be injured. That can lead to cry. This baby has a fracture in the large bone of the leg that can cause crying. This baby has poor circulation on the toes that can lead to crying. This baby has some bites or rash which can cause crying. This baby has a problem in the knee joint, which is swollen and red and can cause extreme pain. Crying. This is a torsion of the testis. The testis is having less blood and become almost dead. That can cause pain, and there may be a hernia which may be complicated and cause pain, and there may be a rash which can cause pain. So what to do? You have to listen to the mother, see the baby's feeding and behavior, see mother's diet, any stressors, and assess the breastfeeding, and examine the baby initiating breastfeeding as soon as possible, and address the medical condition. Then another reason for babies crying is a fungal infection of the mouth, and this is caused by a fungus called Candida albicans, which reaches the baby through the hands, maybe from the breast or bottle feeding. It appears as irregular white flecks on the oral cavity, on the tongue, and it may be painless, and concurrent treatment of the mother and baby is needed using cotrimazole, which is an antifungal. This is a fungal infection of the nipple. It looks scaly and red, and there may be itching. This is a fungal infection of the mouth, which is called oral thrush. And this is a normal baby, which may have slight uh, fungal growth on the tongue, but baby with the extensive fungal infection should be treated. And such babies will have the white curdy-like substances on the gum, on the cheek, and it will be much thicker on the tongue, and these babies need treatment. So thank you for the patient hearing, and we have reached the last slide.